The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to Reproaction's webinar, Spreading a Pandemic, Big Life, Pro-Life in Action. We will start in just a minute. Thank you for your patience. For those who've just joined, thank you for coming to Reproaction's webinar, Spreading a Pandemic, Big Pro-Life in Action. We'll be getting started in just a moment. Thank you.
All right, thank you for your patience as we work through some technical issues. We just want to make sure we have one of our panelists able to speak during the call today. So welcome to Reproaction's Act and Learn webinar for January 2021. It's a very important and timely topic, spreading a pandemic, big pro-life in action. And your host is myself, Erin Matson. I use she, her pronouns. I am executive director and co-founder of Reproaction. I'm based in Arlington, Virginia, and my Twitter handle is Erin to the max. And our agenda today is to introduce Reproaction. Then we'll talk about why a conversation about anti-abortion activists and COVID-19 is important. Then we'll do anti-abortion actions during COVID-19, a brief overview. And then we'll do a panel discussion with Dr. Gabriela Aguilar from the Physicians for Reproductive Health, Cara Hales from A Preferred Women's Health Center, and Antoinette Kelsey from Feminist Women's Health Center. Then we'll do next steps and Q&A. And next on our agenda, I was going to pass it to Cara. Cara, are you ready to speak yet?
Give me just a second, Erin.
Okay, sure thing. So as I'll do a little more intro, then so Reproaction leads bold, direct action to increase access to abortion and advance reproductive justice. We're deeply proud of our left flank analysis and our willingness to hold folks on all sides accountable, whether they are traditionally considered allies or opposition. And we have a deep commitment to nonviolent direct action as one of the tools in our toolbox. And with that, I will pause for Cara. Cara, just let me know if you'd like another minute or if you want to take control and have me try to do some technical troubleshooting on your behalf.
I may need you to do some technical troubleshooting on my behalf.
All right, great. If I don't get it together in time, Cara, just let's have you go and then try passing it to me. If it does not work, we'll just go, I'll flip us over to Cala's Q&A, which you can do with her, and then we'll come back to Gabriela and Antoinette. Sound good?
All right.
Fabulous. So with that, I'm pleased to introduce Cara Mailman, and I'll let them introduce themselves further.
All right. Hello, everyone. My name is Cara Mailman. I am the Senior Research Analyst over at Reproaction. My pronouns are they, them. I live in Arlington, Virginia, and if you'd like to follow me or tag me on Twitter during this webinar, my handle is Thank you. So, why is a conversation about anti-abortion activists and COVID-19 important? Right about now, I would usually try and tie the topic of the webinar into the principles and tenets of reproductive justice. However, with this topic, the reason we need to discuss it is very straightforward. Anti-abortion activists and anti-abortion groups have been continuously putting lives at risk since the beginning of the COVID-19. That's the brunt of why we need to talk about this today, is because anti-abortion activists are putting our communities in danger. Next slide, please. So now I'm going to give just a brief overview of the ways that anti-abortion activists have been behaving and speaking during the COVID-19 pandemic. To start, I want to talk a little bit about the anti-abortion events that have already happened and that are continuing to be planned during the pandemic. To start, let's talk about 40 Days for Life. Many of you have probably heard of 40 Days for Life. They are an anti-abortion group that plans 2 40-day-long anti-abortion harassment campaigns outside of clinics every year. Despite the coronavirus pandemic and the various lockdowns that occurred throughout the nation because of the pandemic, 40 Days for Life held both their spring and fall harassment campaigns outside of clinics throughout the world. Now, if you follow us on Twitter, you have probably seen that we did put a bit of a damper on their spring campaign, using a petition to force them to end that campaign early. However, they still continued with their fall campaign after that and have since announced their plan to launch 40 Days 365, which, like it sounds, is a campaign to ensure that there are anti-abortion activists outside of abortion clinics harassing patients and staff 365 days a year. Now, I've included a picture of one of the anti-abortion 40 Days campaigns on this slide. As you can see, most of the participants are unmasked. None of them are abiding by social distancing. And most 40 Days participants have continued to approach patients and staff to attempt to hand them anti-abortion literature. In a similar vein, Red Rose rescues, which are not listed on this slide, but are frequently associated with the same kinds of anti-abortion harassment as 40 Days for Life, have continued to take place. However, these Red Rose rescue campaigns involve anti-abortion activists physically entering clinics, approaching patients and staff, and frequently refusing to leave until they are bodily carried out of the clinic. Now, next, I have to talk a little bit about the pro-Trump events that have been taking place. As some of you may have seen, Reproaction shared a thread linking anti-abortion activists to the white supremacist violence that took place in DC last week. A number of anti-abortion activists have attended these events, and this shouldn't be surprising. The Venn diagram of anti-abortion activists and white supremacists is a circle. Among those who attended are Abby Johnson, who posted a selfie of herself at this event, and now former West Virginia State Delegate Derek Evans, who before he joined the West Virginia State House was known for harassing patients and staff outside of clinics throughout West Virginia. This is far from a thorough list of the anti-abortion events that have continued to happen. I also think I somehow managed to skip over the March for Life, which is still planned to take place on January 29th. If you look at Reproaction's social media right now, you will see that we have launched a campaign to calling on March for Life to end the march, to not bring tens of thousands of people to the district at a time when COVID cases are spiking, at a time when our community is already facing unprecedented levels of white supremacist violence. We are asking March for Life to cancel this event and help preserve the health and safety of the DC community. Next slide, please. Now, in addition to physically hosting events during the COVID-19 pandemic, anti-abortion activists have been among the leaders of promoting conspiracy theories and anti-vaccine propaganda related to COVID-19. One of the primary faces of these conspiracy theories has been the anti-abortion quote-unquote medical association, the organization known as the American Association of Physicians and Surgeons. AAPS, in addition to spreading anti-abortion theories like abortion pill reversal, has also done things such as promote hydroxychloroquine instead of a vaccine for the coronavirus. Note, hydroxychloroquine is not an approved treatment for the coronavirus. They've cast doubt on the efficacy of a vaccine. They've dismissed the need for coronavirus lockdowns, and they have downplayed the dangers of the coronavirus, as well as the casualties related to the virus. A number of other anti-abortion activists have engaged in similar behavior, dismissing the dangers of coronavirus, calling the dangers overhyped, and casting doubts on the safety of the vaccine. LifeSite News, which is an anti-abortion quote-unquote news organization, has specifically published a large number of articles promoting these COVID conspiracy theories. They've published articles casting doubt on the efficacy of masks. They've cast doubt on the quote-unquote morality of the vaccine by using anti-abortion baby body parts rhetoric. And they've even questioned the existence of the virus. I've linked to an article in the notes in which LifeSite News specifically brought up that they believed it was suspicious that deaths in COVID cases began to rise following the 2020 presidential election. They believed that these deaths were rising not because more people had been exposed to COVID, but because the media was trying to hide alleged election fraud. These antis have found a number of ways to sow doubt about effective means of preventing the spread of the virus. They've cast doubt on the efficacy of vaccines, all while continuing to put the lives of our community members at risk. And I'm very excited that all of you will get to hear from some incredible abortion clinic workers about the ways that this has impacted them and their patients. And with that, if Erin is back, I pass it over to Erin.
I am back, and thank you all for your patience. And we have worked out our technical issues, I believe. So thrilled to introduce you all to Dr. Gabriela Aguilar, who uses she, her pronouns. She is a fellow with Physicians for Reproductive Health. She is an OBGYN and complex family planning specialist at Yale University School of Medicine. Thank you so much for joining us today, Dr. Aguilar. We appreciate having you.
Thank you for inviting me.
Thank you. So just before I dig in with questions, I want to let folks know that if you have questions for Dr. Aguilar, for Cara, or for any of our panelists, feel free to put them into the questions tab, and we'll get to as many as possible at the end. So my first question for you is, how have you and your patients been impacted by the conservative movement's failure to take the pandemic seriously?
Well, I think something that's really important to remember is that the degree of the pandemic, right? So we know that clinics and hospital systems were really pushed to their limits in terms of being able to provide patient care. And that did have an impact for us at the hospital where I work, because we reached a point where we were really only able to provide care in the operating rooms in the hospital for people who are incredibly high risk. And that resulted in us needing to develop a new triage system, because the need for abortion care never stopped during the pandemic. And the numbers of abortions really didn't change very significantly. So we had to figure out how to provide care to all of these patients who still needed it in the appropriate settings, while at the same time trying to preserve hospital resources because the pandemic was so out of control. So that, I think, is one of the biggest ways where we had to tell people who had previously been able to get clinic or hospital care that they wouldn't be able to, and would have to send them to other locations or not be able to provide the full spectrum of anesthesia options for their care.
Thank you so much. And just a follow-on question, a brief follow-on question for that too. I've seen, and I'm sure many of our listeners have seen reports of, on the full spectrum of reproductive care, how challenging it has been for people who are birthing as well during the pandemic. Has the conservative movement's failure to take that seriously and the strain on hospitals, have you seen that also have an impact there?
Well, we did see initially at the beginning of the pandemic major changes in especially supporting birthing patients. Many hospitals, I think, initially maybe erroneously instituted no visitor policies in an attempt to help control the spread of the virus, because of the fact that it had been handled so poorly and was so out of control. And that, of course, has a significant impact on patients who are birthing and their experience. We're very happy to see that a lot of hospitals were able to change their policies or adapt them so that the birthing individual could have some support in the labor rooms. But that is one of the ways that we saw that the scale of the pandemic really impacted care for birthing individuals.
Thank you so much for that. So my next question for you is, do you think, and with the disclaimer, of course, that we do not do electoral work at Reproaction. I know as a provider, that's not your work either, but we do live in an environment that has been extremely dangerous with regards to this election because of a president who's trying to overthrow our country for white supremacist violence. Do you think the 2020 election had an impact on the way the anti-abortion movement behaved during the pandemic?
I'm not 100% certain that it was the election results that had an impact, but we do know that this particular administration, has continued to promote a lot of inflammatory misinformation, not only about the pandemic, but about abortion care in general. And doing so, really what they're doing is adding flames to the fire to these extremists that really, really don't support abortion care. And I think that some of those efforts were, they were really upped in the pandemic because they knew that there was going to be an interruption or compromise in care for so many people.
Thank you for that. So my last question for you, as a provider on the front lines, what do you think are some of the key takeaways people should have, and our listeners in particular who are primarily activists and advocates should take away from the behavior of the anti-abortion movement during this pandemic? Do you think this pandemic has revealed more about what we're up against?
Yeah, I absolutely do. I think we know that this anti-abortion movement, is relentless or unrelenting. We know that they, through their actions throughout the pandemic, they continue to demonstrate that they don't actually value life. If they did, they would be, in support of passing COVID relief bills that value people's jobs, their health, their families, improving child support systems and access to food and water, providing eviction relief. All of these things are what we actually need right now during the pandemic to ensure the safety of our communities. But what they're doing instead is just continuing to show up without masks not social distancing, and continuing to shame the providers and patients at abortion clinics throughout the country.
It's a public health disaster. Thank you so much for sharing. Is there anything else you'd like to share now before I pass it over to Cara and Calla?
Yeah, I think it's really important just to not forget that we've seen so many politicians try to exploit the pandemic and use it to restrict abortion access even further instead of providing all of the relief that I just talked about.
Thank you for that. And that is something that we've watched with great concern. And I do apologize for the background noise that just came up due to the pandemic. I am also homeschooling at the same time as working, but hopefully that should be better now. So thank you for lifting that up. We've seen that happening in the States, and it underscores how not just now, but at all times we must work to increase access to abortion in this country. Thank you so much, Dr. Aguilar. With those of you with questions for her, just please put them into the questions tab. I'm already seeing some coming in, and we'll address as many as possible at the end. All right, and I will pass it now over to Cara.
Awesome. Thank you, Erin. I am super excited to introduce our next panelist, Calla Hales. Calla is an activist and the executive director of a preferred women's health center, which has multiple abortion clinics in the southeastern United States. Her work and activism focuses on clinic harassment, abortion access, and survivorship advocacy, and she is currently a member of the board of Charlotte for Choice. Calla, thank you so much for joining us today.
No, thank you guys for having me.
So my first question for you is, how have you and your patients been impacted by the conservative movements and the anti-abortion movement's failure to take this pandemic seriously?
We have consistently seen protesters outside of our clinics, particularly our Charlotte facility, this entire pandemic. Like you mentioned, I do oversee multiple abortion clinics, but my clinic in Charlotte in particular has a pretty bad protester issue. I've spoken about this with Reproaction with other folks in the past. At this point, we are regularly seeing 15,000 protesters a year. It was my initial thought that this pandemic would make that number lower, and that was just not the case. We maybe saw 10,000 this year, but that's still 10,000 too many. And with their presence, that still created, like you mentioned, a huge issue in terms of COVID spread because of the fact they aren't wearing masks, they aren't using hand sanitizer, they are approaching patients in cars. And their nonstop presence just continuously made patients and staff and volunteers all incredibly nervous about potential exposure and spread.
That is so awful to hear. And Calla, am I right in thinking that it was your Charlotte clinic that saw anti-abortion harassers get arrested because of their behavior during the initial lockdowns?
Yes, we are one of the clinics that did have arrests outside of the facility. There were, I think there were 9 different protesters that got arrested that day because they refused to leave, and we had a restriction of gatherings, no more than 10 people at that time. And at that point that day, there had been 55, which unfortunately is a really small number for us, but it's still, especially in a pandemic, incredibly harmful. As I'm sure most people are aware, getting arrested doesn't really stop antis. In fact, they really love it. So the only things that came from that was more harassment, because now you're seeing politicians like Ted Cruz talking about how the Benhams have been oppressed and persecuted because they got arrested outside my clinic.
I was about to ask if you thought that the arrests had emboldened the antis, and it sounds from your answer that that's exactly what it did. Calla, for those who don't know, would you mind talking a little bit about the unique situation that your Charlotte clinic is in regards to the ways the antis are able to mobilize those numbers around it?
Sure. So our Charlotte facility has a couple of things working against it in terms of protesters. One of the first things that is really easy to exploit, unfortunately, is the fact that its layout, the geographic layout, is on the back of a industrial circle, meaning you can get protesters stopping patients from both sides. Because you're not on a main road, any type of real traffic issues are for the most part ignored because it's not considered public nuisance because it's a side road. Now, in the past 5 years, we've seen a massive increase in protesting presences with this group called Love Life Charlotte, originating in Charlotte, and they've more recently become Love Life, and have started to spread into other cities. So they actually started in Charlotte and have created this movement called the 40 Weeks of Life. And every Saturday, they have massive events outside the clinic that look a lot like concerts with stages and musicians. And they have actually been given the property next door to our administration building so they can put all of their sound speakers on private property so they do not have to work with public laws about sound ordinances.
That is always so distressing to think about, just the level of access they've been able to get to you and your clinic and your patients, especially at a time like this where they've continued to harass people and endanger patients' lives. Last Wednesday, white supremacists, as you know, violently stormed the Capitol, among them a number of well-known anti-abortion activists. Can you discuss some of the ways that white supremacy and anti-abortion views are connected, as well as how those ideologies are reflected in the actions of anti-abortion activists during the pandemic?
Like you mentioned earlier, like it was the best soundbite I've heard in a while. The Venn diagram between anti-abortion protesters and white supremacists is a circle. We are constantly hearing racist misinformation outside of the buildings in terms of protest information and what they're giving to patients, specifically targeting certain patients based on how they look, or their companions on how they look, what they think of them. I regularly see our very white protesters targeting Black men and basically harassing them about their masculinity because they think that bringing their partner to the clinic is somehow, quote unquote, emasculating them. Now, that's something we constantly see, but that kind of brings it to a larger point because both white supremacy and anti-abortion, I guess, policies and protests are really have nothing to do with necessarily race or medical care. What it has to do with power. These are both huge problems that people are using to keep themselves in power. And it's not something that can go away easily. And it's something that has kind of insinuated themselves into each other's movements. So you never know when you're looking out on a sidewalk and seeing protesters these days, is this person a Proud Boy? Is this person a Nazi? You don't know. And that's become really terrifying.
I cannot even imagine, and I feel so much for especially the companions that you mentioned who are having to find ways to deal with these both racist and anti-abortion attacks. Calla, is there anything else that you'd like to say before I pass this back to Erin and Antoinette?
Not particularly. I think, you guys are really covering it, and I'm really interested to keep hearing everyone's thoughts.
Well, Calla, thank you so much again for being here and for your perspective and for your work, especially at this time.
No, thank you.
Thank you, Kella, and thank you, Cara. And next up, I'm very pleased to introduce Antoinette Kelsey, who is originally from Riverside, California. However, she has been living in Atlanta, Georgia for 3 years. She's currently a first-year graduate student in public health at Mercer University. She has been working at Feminist Women's Health Center for 2 years and was promoted as front office supervisor in February 2020. So talk about someone who is on the front lines right now. Antoinette, thank you so much for joining us, and thank you for sticking the course through technical hiccups.
Yes, you're welcome. I'm glad to be here. So far, it's been very informative and just interesting to hear everyone's perspective of what's been going on and what, different clinics are going through, just the same as, what me and my staff have been going through. So.
Thank you. Yeah, we're really excited to hear from you. So some of these questions will be repetitive, but we want to hear, what's the same and what's different. And please do share what's going on down in Atlanta right now. So the first question for you is to ask, how have you and your patients been impacted by the conservative movements and, of course, the anti-abortion movement's failure to take the pandemic seriously? How is this impacting your ability to provide care?
It seems like the antis that come to our facility have become more aggressive. I like to monitor. There's one in particular that comes to our clinic a lot. And so we found their Facebook page. We, look at their Facebook page from time to time. And I noticed that he goes to other clinics in the Atlanta area and even outside of Metro Atlanta. And so they come, they'll wear masks. I've definitely noticed that they do wear masks, but they have become more aggressive as far as just, banging on the patient's driver's door or car windows just to get their attention, throwing like a quote unquote blessing bag into the vehicle once when a patient, pulls in, or they're quick to using, their megaphone to talk and harass staff. I know I've been harassed by them as I pull into work as well. And recently, about actually a few months ago, that same anti stalked and followed one of my staff members to a fast food restaurant up the street from our clinic, which was very alarming and, again, very bold. And someone knew who to target as far as my staff goes. This staff member is African American. And so he, harassed her while she was trying to get some food and was trying to cause, ruckus in public by, making it known, asking her like, why are you killing babies? And just, saying some very like derogative language. And even granted, with her being African American, of course, he used the language of, does Black lives really matter? I've heard that too, constantly, especially with the political climate that's been going on. That's the language that our antis use at our facility, because most of our clientele is predominantly African American. So that's been very, traumatizing for our patients. Yeah.
Yes, traumatizing and terrifying. And it feels wrong to say thank you for sharing that, but I do thank you for sharing your experience and the experiences of what your staff and your patients are being forced to confront with the violence of the anti-abortion movement as you provide care. I'm going to skip. I think that's a good seg, and I'll come back to another question specifically about Georgia in a moment. But as we are discussing the interlinkages of racism and the anti-abortion movement, same question for you that Cara posed to Kala. So last Wednesday, white supremacists violently stormed the US Capitol and attempted to overthrow the election, among them a number of known anti-abortion activists. Can you discuss the ways that white supremacy and anti-abortion views are connected, as well as how those ideologies are reflected in actions of these anti-abortion activists during the pandemic?
Yes, they are connected with each other, white supremacy and anti-abortion, because I believe that, they both want to try to hinder the betterment of, a person, a non-white person, as far as having the pursuit of, of happiness and liberty, and also just equality in general, like healthcare, like socioeconomically, and even like they don't understand the circumstances that our patients go through, and they don't want to try to understand. And so I think that last Wednesday's incidents was very alarming and excuse me, hurtful, because this is supposed to be America, and it's not the United States. And that was a reflection of two Americas. So I think that with both of the agenda of white supremacy and anti-abortion is the fact that they don't want what they feel is normal and right is the fact of just having this continual mentality of superiority and inferiority, but they use God in the mix to cover it and make it seem like it's not, you know what I mean? It's not, they try to use that as the foundation, when in actuality, it shouldn't be that way. It should be, again, just everyone should or deserves the opportunity to choose. I mean, everyone has a right to choose, and then also to, it's our bodies at the end of the day too. So I think it's very, it's been traumatizing and to process it. So I do apologize for rambling. But yeah, I think that they're definitely connected, because again, it's just they want to keep a certain group, in a higher power than the other, which is, alarming.
Thank you, and no need for apology during this horrible, absolutely horrible moment in our country. And thank you for raising the reality of two Americas that we are seeing on display. And I want to turn and acknowledge that in this week of such deep lows, there's also been a really big high where you live in Georgia with the election. And I wanted to ask specifically about that as it pertains to the anti-abortion movement and the footprint around your health center. And the question is, did the behavior of the anti-abortion opponents change at all around the Georgia runoff election?
I'm sorry, can you repeat that? I kind of hear barking in the background. I'm sorry.
I know, I'm trying to mute myself too and simultaneously say it. I have a dog and I can't close the door because of
it's okay.
COVID is a mess. So the question is, did the behavior of the anti-abortion harassers outside your clinic change at all around the Georgia election?
I don't believe so. I think that it's still, like I said, it's still the same. It was the same climate as when the election was coming around. The narrative that the antis have been, using again, is just the fact that, the whole, Black Lives Matter, trying to implement that in their tactics as far as getting into folks' skin. So I would say there wasn't really much of a tension going on closer to the Georgia runoff. However, we are and we have been hyper vigilant now, even more, especially what happened with last Wednesday, and even closer to when the administration, gets sworn in. So yeah, I would say the climate is just the same. Yeah.
Thank you for that. And I appreciate your insights and your patience with me at this moment. So is there anything else you'd like to share before we move on to next steps and then open Q&A?
I will say that I do empathize with other clinics, like what Preferred Health, Women's Health is going through. Our facility we have is like uphill. However, I see from being upstairs the trauma that antis try to inflict on our patients. So I hope that we all can somehow, some way figure out, and as far as getting law enforcement on our side. I think that's the frustrating part of even working at our facility. Like the county police department isn't really on our side, and they're quick to throw out excuses or tell us what measures we need to do, and as far as just catching our antis going above the loud noise ordinance. So it's just, it's very frustrating. So I definitely can empathize with you all on what you all are experiencing, excuse me.
Thank you so much for highlighting that. And that is a good note to seg into the next phase of the webinar. So a quick urge to plug into Reproaction campaigns. So first of all, please join our call to cancel the March for Life. That is accessible on our website. It's on our homepage at reproaction.org, and you can sign up for action alerts at reproaction.org. We can be followed on social media at Reproaction on Facebook, Twitter, and Instagram. If you sign up for our email list, we do these Act and Learn webinars every month, and they're free and open to the public. They're designed to create a space where activists and advocates and others can come together and share strategies, share information and what's working and what's not, and learn from one another. So we don't want to miss you on this. So the next webinar next month, very excited about this. This will be led by Tanasia Henson, our campaign coordinator, based in North Carolina, and it will be on reproductive justice and astrology. It will be taking place on Thursday, February 4th at 1 p.m. Eastern. And with that, I will encourage folks, I'm seeing some questions come in, so I want to encourage folks to put in any questions you have into the questions box. They can be for Dr. Aguilar, for Cara, for Antoinette, or for our researcher, Cara. So first up, I'll do, so we've got a question. It says, for Dr. Gabriela, has there been a noticeable shift from surgical abortions to medical abortion prescriptions? How has that affected abortion access and patient care?
Yes, actually, there has been a shift, and I think a preference too for some patients, because they, if they were able to provide a follow-up option that doesn't actually require coming back to the clinic or, increasing their risk of exposure, then many people were opting for that. Now, of course, due to the REMS requirements and prior to the injunction where it was temporarily lifted due to the pandemic, we know that the mifepristone that's needed as the first step for medication abortion has to be administered in person. And so, that begs the question, can we really, one, are the REMS requirements necessary? And I think many of us agree that they are not. And two, the mifepristone is a safe drug. And two, huge conversations regarding telehealth and telemedicine came out And there's a lot of work that's been done, and the pandemic has given us this opportunity to show how safe no-touch medication abortion can be. And so I do have to say that it's probably one good thing that has come out of the pandemic, is being able to continue to support telemedicine or telehealth for abortion care.
Thank you so much for that. And just a follow-on question, when you say no-touch medication abortion, is that exactly what you mean, telehealth, when somebody gets the medication through a visit online?
Exactly, without having to come into the healthcare system to obtain like any blood work or ultrasounds or have any physical exams done. There is a very like special low risk population where that delivery of care is appropriate.
Wonderful. Thank you for that. And here to increasing access to medication abortion. So another question that we have that came in for Antoinette. First, you're getting a compliment on the liberal Jane illustration art behind you in your picture, and smiling because liberal Jane is an important ally of us here at Reproaction as our outreach and culture manager. But the question for you is, since the pandemic hit, how has access to abortion care been affected in Georgia?
It's been affected tremendously, especially for our clientele who are having, financial issues due to being laid off or not being able to work. So we've been doing our best as far as making sure that they get the necessary funding from the National Abortion Federation and other supporting funding organizations that cater to the southeastern region of the United States. So yeah, it's been, I've heard, many stories, not stories, but just cases where, patients are choosing to pay, either having to pay or prolong their paying their rent, to just have to be seen by a provider here. So it's very, heartbreaking, and I wish that the government did more as far as just helping all Americans, not just giving, $600 for a second round of stimulus, because it's definitely been, it's impacted, the pandemic has definitely impacted our clientele with financial hardship, so.
Thank you for sharing that. So next question is for Cara. The questioner says they've seen a lot of TikToks from clinic escort at Charlotte for Choice, and they find them quite hilarious and eye-opening. How do you think social media has affected activism and abortion opponents, especially in light of the pandemic and staying at home and things like that?
First, let me say that I was kind of glad I was muted for a second, because when you started that question, I heard the word TikTok, I just started hysterically laughing, because this has become my most commonly asked question, as I'm sure you guys can imagine. One of the things that's come about for us specifically with our volunteers during the pandemic has been this really odd intersection of having an increased volunteer population because we now have students that are no longer going off to college. They're doing online school, and they're present in Charlotte and want to help. We also are seeing at the same time these increasing aggressions outside of the clinic that have constantly just, gotten worse over the years. And it's, we've tried for years to a non-engagement policy, and we've gotten to a point where there isn't any point in not engaging anymore. As long as it's off property and you're not interfering with patients, interfering with protesters and their ability to distract people and harass people is free game on public property. Now, with all of these new volunteers came TikTok, and I have to admit, I am not hip. I don't know how to TikTok. I am real bad at it, but I know that a lot of these new volunteers are phenomenal at it, and it has opened so many avenues of communication and education for getting out the message, especially about what protests are like out at the clinic, but also just general misinformation about abortion. There are other TikTok accounts that aren't from the clinic or aren't from Charlotte for Choice that do incredible jobs of correcting misinformation about abortion care. I wish I knew the handle. Maybe someone else does and can pop in with it, but it's seeing that access and seeing how many people can truly understand these things and feel free to ask these questions in anonymity through TikTok is pretty amazing. Hello.
That's what happens when I mute myself. Sorry about that.
Sorry, I just wanted to make sure I didn't drop or anything.
No, you're totally right. No, I was just over here. I'd like to pretend that I was like TikTok dancing, and no, I was not. So would any of our other panelists like to weigh in on TikTok and this moment?
I like watching TikTok videos, but I haven't participated in any. But I have seen some TikToks from your clinic in Charlotte. They're awesome.
Thank you so much. I know it's a little interesting because, especially with other providers, that it's a very different different tactic that not a lot of clinics use. And I don't even use it at my other clinics, but I'm very strongly of the belief that each clinic's got to do what's best for them. And sometimes that's engaging and sometimes that's not, but it's really lovely hearing other providers say that they are getting some sort of enjoyment out of it.
Yes, I love them. They are great. I don't use TikTok myself, and I'm not sure that I will, but I've really enjoyed watching them.
Thank you. All right, we can get our TikTok on. So just also a comment. So we got a comment in from someone presumably in Arkansas, letting us know that the Arkansas March for Life is scheduled for this Saturday, January 17th. Oof. This weekend, or they said Sunday, the 17th, just letting folks know that the National March for Life that we're calling for the cancellation of is on January 29th, 2021. And there is zero acceptable reason for them to be holding that in person and inciting people to gather. Actually, if you go to their website, it's a horror show. They are not only proceeding as planned, but encouraging folks to organize buses to travel across the country to come to that march. So super spreader to the max. So we got a question in about just looking for more information on the intersection of racism in the anti-abortion movement. And I wanted to share that on the resources section of the Reproaction website, we have a whole host of resources on this, including a recent webinar that we did that focused on racism and anti-abortion fake clinics and the linkages between them. We've done a number of blog posts on the racism of the anti-abortion movement, and I want to lift up our Deputy Director, Shireen Shakuri, and the work that she has done on abortion pill reversal, many blogs that you can find on our blog, and also Tanasia Henson, who has also done a number of blog posts recently in the recent past about racism in the anti-abortion movement, and much more that is available on our website. So please do check out the resources section and our blog for that. Also a shout out from a clinic escort in Queens, New York, who just says that they're offering support and thanks. So I hope that you all feel the love from folks on the line from the advocacy community. And then another question. So I believe it was Antoinette who referenced how people use a perversion of religion or claim that the hateful behavior that they're doing is in the name of religion. Of course, debunking that with the fact that there are many people of faith who support the right to abortion, and the vast majority of religions call for peace and love, and not the behavior that the people who claim to be holding it up do when harassing people seeking abortion care? This question is, and I'm gonna flip it a little bit because it says, but just do you have any information on specific denominations that are most involved in harassing the places where you're serving patients? Do you have any information on what they say is their theology? And I'll open that up to any of our panelists.
For our clinic, I believe from, again, you know, screening and monitoring one of the Anti's like Facebook page, he comes from I want to say in evangelical Christianity, because and then also too, he doesn't agree with like Catholics who come to our facility to pray across the street from us. So he hates like pro-lifers that are peaceful. He likes to be more disruptive as far as just being loud, using a megaphone, quoting Bible verses, and yeah. So I would presume that he is evangelical.
I would, this is Cara. I would agree. A majority of our more aggressive and involved protesters are definitely evangelical. However, interestingly enough, the setup that Love Life has during their 40-week campaign is having a church sponsor each week, and then all of the churches come together on the last week during their big 40th week march that usually pre-pandemic nets a couple thousand people. This year during pandemic, it was only about 700 or 800. I know that I said only, and I'm a little disgusted with myself. But because of this setup and the lack of real commitment they have to have, you're seeing a lot more of the more mainstream churches that come out. People you wouldn't expect. There's Episcopalian churches, Catholic schools. We are a quote unquote field trip site for homeschools and several local Catholic private schools, all because Love Life has made their brand of harassment Instagram friendly. They're known for giving out these bright teal t-shirts, and you feel like you belong because you're all there in your t-shirts and your get-ups and it's your friends from class, and you know you've been told you're saving somebody when in reality all you're doing is just harming everyone. So because of that, you're seeing so many more denominations that come out. I can say that as a Jewish person, it can be sometimes very jarring to hear the Holocaust references that come into play, because that is something that no matter the denomination I am hearing nowadays, and especially with the evangelical Christians, that is something that they're really pushing, is comparing abortion to the Holocaust.
Yes, incredibly offensive. So we are just about at time, and I'll let folks know that there's a number of folks are chiming in that they see folks who claim to be speaking for Catholic religion outside their faith clinics where they do escorting. So I wanted to just thank you so much to our panelists, Gabriela, Cara, and Antoinette. This has been a really enlightening discussion, and my deepest thanks to Cara Mailman, our senior research analyst who pulled this all together. Thank you so much, and we look forward to seeing you next month for reproductive justice and astrology. Have a wonderful rest of your day. Thank you.
Thank you all. You all be safe and take care.